Lovely. All righty. Well, we'll let people in as they come, but want to make the most of your time, Jameel. So, hello, everyone. Thank you for joining us. It's wonderful to see you all. And whether it's daytime or evening for you, hello. We are joined today by Dr. Jameel Muzaffar, and I won't remember all of his credentials. So Jameel, could you let us know what you do, what you work as, and your relationship with tinnitus? That'd be great.
Sure. Hi, Lily. Good evening, everybody else. I'm Jameel Muzaffar. I'm a consultant ENT surgeon in the UK National Health Service, what Americans would call an attending ENT, I guess. I'm an otologist, which is an ENT surgeon that specialises in problems of the ear, hearing and balance. And that's, I guess, the main part of my working week. And then I spend the rest of my time either as Chief Scientific Officer at Otto, so I'm in charge of the research programme here at Otto, and otherwise working on other bits of hearing research, predominantly clinical trial work.
Brilliant. And if you didn't already know, Jameel is one of Otto's co-founders. So very much at the beginning of Otto, Jameel was here. Lovely. We're going to start with some kind of broader questions, but I can see a couple of questions coming in. Thank you so much. Keep them coming. We will make sure that we answer them, but we'll start just with a few broader questions to kick us off. Also, sorry, I didn't introduce myself. I'm Lily. Sorry, Anne, I have managed to allow you to talk. There you go. I have worked with Otto for a long time. I mainly work with our team of therapists, creating content and also leading our one-to-one program. So the content that you hear in the app, I help to write it, and that's my voice if you have listened to the app at all. So you've told us a little bit about the work you do with tinnitus, Jameel. I don't know if there's anything further you want to add specifically. I think it would be great to hear what you think the current challenges are in understanding and treating tinnitus.
Okay, sure. So my patient-facing work with tinnitus is predominantly in the outpatient clinic setting. People come to the clinic sometimes just about tinnitus, but often tinnitus in the context of a hearing problem or a hearing and a balance problem at the same time. It's predominantly adults that we see, although we know that children also have tinnitus, although they often don't recognise that that's what it is, or the adults that care for them don't recognise that that's what it is, and children often don't realise it's anything out of the ordinary either. So yeah, that's my main sort of patient-facing clinical role. In terms of research, the main tinnitus project that I'm working on at the moment, we're running a randomised control trial where we're comparing smartphone-delivered tinnitus therapy against a human therapist, essentially. And that study's just opened. So that's what takes up most of my academic time at Otto at the moment. Brilliant.
And in terms of where you think the main challenges are with understanding tinnitus and also treating it, where do you think those main challenges are?
Well, I mean, the honest truth is that tinnitus is incompletely understood. And there are a number of issues around that make what most patients are looking for, which is a sort of a magic bullet cure, make that really difficult. So a modern understanding of tinnitus is that whilst it may be initiated by a problem in the ear, it's continued and perpetuated by changes in the brain. So upregulation, what's called central gain. And okay, that's fine. But then where do we go from that? There's no obvious therapeutic target. So if you think about the way that most medicines work, when you eat a medicine, medicines are just chemicals, and the chemicals are targeted usually at some other molecule or receptor somewhere in your body. And part of the problem at the moment is we don't know what the receptors would be to target for tinnitus. The other issue being that we don't have good tests for identifying it or for dividing up different kinds of tinnitus with testing. So, conventional hearing tests provide some kind of correlation with tinnitus. They don't really tell us how people are affected by the tinnitus, whether it's mild and it doesn't really bother people, or they're, hugely affected by it, or they can't sleep. So we rely on questionnaires and patient self-report. So the efforts in order to do things to help people with tinnitus are broadly divided into trying to have better diagnostic tools, so things to identify who has tinnitus, what type of tinnitus, whereabouts in their ear/brain that it may be occurring or being perpetuated. And then the other side, which is a therapeutic approach, so trying to do something to deal either with the symptoms of tinnitus or the distress that tinnitus causes, which is actually where most of the evidence-based effective treatments are at the moment, or trying to cure tinnitus, which there are drugs in trials, but there's nothing that looks like a miracle cure at the moment.
Okay, cool. Let's come back to a few of those things, because you gave us loads there and we probably want to pull out different threads. I think it would be good to know, at the beginning you were talking about why it's so hard at the moment to almost figure out the root cause of tinnitus. Are there any supplements which have been known to work or help, even though the kind of reason for tinnitus might not be known? Do supplements ever help or work?
Okay, so supplements are widely touted as potentially helpful for people with tinnitus. Supplements, as with most health supplements, not just for tinnitus, supplements are generally only really effective for people who are deficient in whatever it is that's being supplemented. So, for example, I'm vegetarian, and other people with restricted diets are potentially at risk of lacking some nutrient in their diet that can cause all manner of health problems, including tinnitus for some of them. However, if you're eating a healthy, balanced diet, it's very unlikely that you're going to be vitamin deficient. And therefore, it's unlikely that supplements are going to be more effective than placebo. However, I would say that if you do have a deficiency, then correcting that may well improve your tinnitus. Okay,
interesting. Thank you. For those who've joined since we've started, hello. If you can see the Q&A box down the bottom, please do drop any questions in. This is Dr. Jameel Muzaffar, an ENT consultant.
Sorry, just before I forget.
Yeah, go ahead.
When it can be really hard for people with tinnitus to get good, impartial information about what does or doesn't have scientific evidence behind it. The British Tinnitus Association has a really good section on their website where they have a sort of a traffic light coded system for how much evidence there is to support all manner of treatments, including loads of different supplements. So it's kind of green if there's good evidence that it's effective, orange, amber if it's unclear whether it's helpful or not, and red if there's evidence that it's bad for you, basically. And I'd really encourage people, if they're interested in any particular supplement, to go and have a look at the British Tinnitus Association website, because they are impartial and the information there is good quality.
Great, thanks. I've just pulled it up actually, and I will put it in the chat, that link to that website. So 1 second. There we go. It's in the chat if you wanted to have a look at that. And we do have a specific question about Cortexy, the supplement. I don't know if you have it off the top of your head. I know that the Tinnitus UK website talks about Cortexy.
It's not one that I'm particularly familiar with, but there are tons of them. And to the best of my knowledge, there's no good evidence that any one is any better than any of the others. And I'd reiterate, if you're eating a healthy and balanced diet, it's unlikely that supplements will cure your tinnitus.
Brilliant, thank you. So there's some excellent questions here about like the best approach to treat tinnitus. Let me see this one here from IN. What's the best approach to treat tinnitus, do you think?
Well, I mean, that depends patient to patient, but in the broadest terms, the important things to do are to get yourself appropriately checked out to make sure that there isn't something else going on that might be the cause of it. There are, in many people, there's no obvious cause for their tinnitus, but in some people there are. So, for example, some people, if they have cancer, they're treated with medicines called chemotherapy. And some types of chemotherapy are particularly bad for damaging the inside of the ear and causing tinnitus. In the same way, sometimes when people are very sick and they go to intensive care and have antibiotics pumped into their arm, some of those antibiotics can be damaging to the inside of the ear as well. So there may be a cause like that. Sometimes it can be caused by other things, medicines like diuretics, what people might call water tablets. That's quite a common medication. Aspirin, particularly in high doses, aspirin causes tinnitus, although if you stop taking the aspirin, your tinnitus typically goes away. So there can be causes like that. Most commonly, it's related to damage to the ear, often related to aging, and it may well coexist with other problems related to the ear. So we know about 80% of people with tinnitus will also have some hearing loss. And for those people, the best approach is often combine a mixture of sound therapy of some type, and if they're suffering with distress in response to their tinnitus, then some kind of therapeutic approach, normally cognitive behavioral therapy. And sound therapy can broadly be divided into two types. So one is to use a hearing aid, and hearing aids generally in tinnitus are effective because for a couple of reasons. So one is that they make the sounds of the world around you louder, which often helps to drown out your tinnitus. And the second reason is that often if people are struggling to hear, they have a high listening effort. So they need to put a lot of effort and energy into trying to get sound information from the world around them, which often makes their tinnitus worse as they become tired and stressed and things like that. So that's got two beneficial effects. And then the other way that sound therapy is usually helpful is as what's called masking. So essentially playing sound that helps your brain to tune out the perception of tinnitus. And I could already see some of the questions are asking about neuromodulation devices, bimodal stimulation, which I'm sure we'll come on to talk about in a moment, which use a mixture of sound therapy essentially and somatosensory stimulation, so something that's stimulating your tongue or your cheek or your neck.
Yeah, thank you. In terms of the NICE guidelines, they speak really positively about CBT. Would you be able to just quite briefly give us an explanation of what the NICE guidelines are and why they speak so well about CBT?
Absolutely. So NICE is the UK National Institute for Health and Care Excellence, which is a very complicated name to say that it's the government body that assesses whether healthcare interventions are both clinically effective. So do they work to make whatever it is that the patient's struggling with better, and also are they cost effective? Because in the UK we predominantly have a taxpayer funded system, so the government's very bothered about not just does something work, but can we afford it? And CBT, cognitive behavioral therapy, is by some distance, in fact by an incredibly long distance, the most evidence-based treatment for people with tinnitus. It's been proven to be effective in a large number of randomized control trials in a number of different countries and different settings. And then there are ways of scientifically combining the results of different research studies together in things called a systematic review and a meta-analysis. And again, those are strongly supportive that cognitive behavioral therapy is that's the best evidence-based treatment for improving tinnitus.
Brilliant, thank you. So yeah, you mentioned it, and you can see the questions. I'll I'll let everyone see them in a moment. But what is your opinion of the new Linear device? So maybe you could just explain what Linear is, what they're offering, and then maybe what your opinion of it is.
Okay. Well, I mean, it's not, we're not here to, I guess, to talk specifically about one company's device. So Linear is a company which I think is based in Ireland, that make a device which is a combination of playing sound into your ear and how to describe it, a sort of an attachment that you put on your tongue. So you get sound therapy into your ear, and it's timed with very small electrical stimulations to your tongue. And it's an example of something called bimodal stimulation. And there are a number of designs, prototypes of these kinds of devices made by different companies. The other one that people often ask us about, there's an American group led by a professor in Michigan called Susan Shaw. I forget the name of the device, but it's often called the Michigan Tinnitus device. And that's a very similar principle, the idea of this bimodal stimulation, although in that example, it's sound and then stimulation around the face and neck rather than onto the tongue. There's no comparative evidence of one being better than another. I think, you know, it's a promising area that merits further scientific inquiry. It's certainly not at the stage where I routinely recommend it to patients. But that, you know, that's not to say that it doesn't work or that I don't think it's any good. I think the jury's out.
Yeah, that makes sense. That makes sense. Thank you. Just a note, if you've got your hand raised, thank you so much. If you're able to drop your question into the Q&A box, that would be brilliant, because then we'll make sure not to miss it. I suppose there are a couple of specific questions around drugs and things, and we'll come back to those in a moment. I would be keen to know what you think are the most exciting recent breakthroughs that there are in tinnitus research. So for you, what are the most exciting recent breakthroughs?
Interesting question. I mean, I think the thing that as ENT surgeons we would be most excited about for tinnitus is the thing that I think most patients would be most excited about, which is a drug treatment or a cellular treatment or a gene therapy treatment to take tinnitus away. You know, an injection in the ear, a pill, whatever it would be. And we've seen some drugs enter clinical trials, but we haven't seen anything with a really big therapeutic effect. What there are at the moment is more than 90 different agents for either regeneration of the inside of the ear or for what's called otoprotection. So before, where I mentioned, for example, that chemotherapy can damage people's hearing, or exposure to loud noise. So for example, people who work in the military or in construction or something where they're often exposed to loud noise, that can damage their hearing. So medicines that protect against those, I think, are very exciting for hopefully stopping people developing hearing loss and tinnitus in the first place, and seeing where those regenerative therapies go in terms of trying to repair parts of the inside of the ear that may have been damaged. I think, you know, for the medium term future, that's the most exciting. That's the most exciting avenue. Certainly, that's the thing I'm most interested in and would most like to see be successful.
I'd not heard anything about that. My question off the back of that, though, is if I'm, you know, that there might be people here who are currently really struggling with tinnitus and finding it really challenging at the moment. What advice would you have for them based on the latest research right now? Do you know what I mean?
So right now, the by a long way, the most evidence-based treatment is CBT. And I would return to my earlier answer that you should go and see an audiologist or an ENT surgeon. You should get thoroughly assessed, have a workup of your hearing. If there are things about your hearing that are concerning, say, for example, tinnitus just in one ear, that can have causes that usually your doctor would want to look into for you. Tinnitus that sounds like your heartbeat rather than sounds like more typical tinnitus, which is usually buzzing or hissing or ringing. Those are the noises that people usually talk about. Tinnitus that sounds like your heartbeat instead can have a number of other health causes that might underlie that. So you should go and get checked out properly by somebody local to you. And once you've been appropriately checked out, if hearing aids are a good option for you, you should certainly think about that. And if you're otherwise struggling, you should look at getting some tinnitus therapy in whatever form it is that works most for you.
Thanks. That's great. And I suppose just to clarify, if nothing, we speak to quite a few people who've got pulsatile tinnitus. That's when it sounds like your heartbeat. Once you've ruled out any underlying conditions, it is still effective to use CBT and all the other stuff you're talking about, right?
Yeah, that's right. So so most people with pulsatile tinnitus, you don't find a worrying underlying cause, but it can be anything that changes blood flow, so anemia, pregnancy, hyperactive thyroid, those kind of systemic problems. It can be, very rarely, it can be caused by growths inside the ear, so paragangliomas, aberrant blood vessels. It can be caused by thinning of bone. There's a big vein called the sigmoid sinus that runs in the bone behind everybody's ear, and normally we don't hear blood flowing through that, but in some people the bone can become thinned over time, and then the sound of the blood moving through that fat vein behind your ear can be heard in the ear. So that's, these are there are loads of other reasons that people get pulsatile tinnitus. They're just a few examples of it.
I mean, I realize it's your job, but your ability to remember long words is astounding. You can name everything. I've got a great question here that I'm sure applies to many people. You've had tinnitus for a long time, you've tried CBT, but it's really hard to deal with what people call spikes, what we at Otto probably would rather call fluctuations. When you're having a spike or fluctuation, which lasts for kind of days, what's the advice? Is that normal? And how do you deal with it? What would you say?
Well, I mean, probably worth pointing out that I'm not a therapist. I'm a doctor. I think the first thing is to recognise that tinnitus is what we would describe as being autonomically mediated. So your nervous system is, broadly speaking, divided into two portions, one of which governs things like whether you are relaxed and resting and digesting your food, versus when you are feeling threatened, so that kind of fight or flight type of response. And that means that anything that is stressful, and that might be a physical stress like you're going to run a marathon, or it could be an emotional stress, be it family problems, money problems, work problems, whatever kind of problems it is, all of those cause autonomic arousal and can make your perception of tinnitus worse. And those kind of fluctuations or spikes, whatever words it is that you choose to use them, are those are a normal part of everybody's lived experience. And it isn't a catastrophe if you are having a period that is tough, because that's something that we can all recognize. We've all had, particularly over the last few years, everybody's had tough times, and it is okay to recognize that you're not doing so well and to seek help. And that might be in-person help from your audiologist or doctor or whatever, or it could be via an app like Otto. There's other kinds of tinnitus first aid that people can find helpful. So I think the first thing is just to acknowledge that that's what it is, and that it is normal for people to have ups and downs with respect to their tinnitus, like with the rest of their life.
Yeah, thank you. I spoke to a couple of people recently who had a helpful way of approaching it, where you can definitely have coping strategies for those negative fluctuations, and they will come. We don't need to worry about them or fear them. when you've got the coping strategies in place, because you know that you'll be able to get through it. But what one person said to me that I found really helpful was, actually it's quite a helpful ally. If you're having a negative fluctuation, it's probably telling you something about your general well-being, which is good to listen to. So sometimes those, it's painful and it's frustrating, but those spikes, as you might call them, can be quite a helpful signal that there's something to pay attention to, probably a stress level or something like that you were just describing, Jameel.
Yeah, absolutely. I mean, it's not exactly the same, but I get migraine, and migraine's a kind of bad headache, and I only tend to get it when I am sort of run down, if I'm really tired, if I haven't been sleeping well, haven't been looking after myself, haven't been drinking enough water. And when I start getting the aura, which is something that people often get before they get migraine, obviously I feel terrible because having a migraine is awful, but it is also something that just makes me a bit more aware of the fact that I probably have been pushing a bit too hard, and that I need to make a little adjustment.
Thanks. Yeah. I'm just going to take us slightly in a different direction, because there's quite a few questions here. Let's try and whip through them as much as we can. There's some that can be quite quick, I suspect. So can CBD, so different to CBT, CBD.
Yeah, very different.
Yeah, very different. Can that be helpful?
Well, some people find CBD, which is a derivative of the cannabis plant, they can find that relaxing, and things that are relaxing and make you feel calm, in principle, often will make people feel better about their tinnitus. There's no good evidence that CBD is a cure for tinnitus, or that everybody should be chugging away at CBD all the time.
Yeah, absolutely. Yeah, you kind of want to interrupt that stress cycle, and there are plenty of things that you can use to do that. There's a quick question around Tinnitus UK. They've got a biobank study. Could you describe what this is, and do you think it's valuable?
Okay, so biobanks or other bioresources are efforts to collect lots of data about people, either with a particular problem or who you particularly identify don't have that problem, so that you can better understand what's going on. So as we talked about earlier, tinnitus is incompletely understood. We don't know exactly what's going on in the brain to cause tinnitus, and we don't easily know how to tease those bits apart. And there are a number of these resources going on. So there's that one, there's the Nottingham, University of Nottingham and Nottingham universities have a bioresource, which is a sort of a hearing one with lots of hearing data in it. There's a thing called the Health Informatics Collaborative that's run from University College London. So there's lots of these efforts to collect lots of, what you'll see in the media described as big data. So lots and lots of data that you can potentially apply machine learning techniques or AI approaches to try and better understand what's going on, to help to stratify patients into different groups. And then potentially in the future, the idea would be that if you identify, okay, so we can see that all of these people, of the people with tinnitus, these ones have similar characteristics. And then maybe we discover that one drug works particularly well for people who've got those characteristics. That's good. That helps you match up your treatment against the people most likely to benefit. And equally, if you discover that one group doesn't do very well with your treatment, then it's actually helpful to know that before you start wasting people's time.
Thank you. I'm just going to keep whipping us through because we've got loads of questions here. So I'm really working you hard here, Jameel. There's a couple of questions around, someone's been prescribed amitriptyline, and there's another question around antidepressants. I believe amitriptyline is an antidepressant. Is that true? No, they're different.
So amitriptyline is a drug that is sometimes used for anti-anxiety or antidepressant activity, but it also has a number of other uses. So it's used for what doctors describe as neuropathic pain, which is nerve pain rather than somatic pain or visceral pain, as you would otherwise describe pain. It's used in migraine, particularly in migraine prophylaxis sometimes. So it's a drug with lots and lots of different uses, some of which are antidepressant, some of which aren't.
Does it help tinnitus?
Oh, that's an interesting question. So people who are struggling with their mood, often if their mood improves, will say that their perception of their tinnitus has also improved. Now, whether that's a direct, has it helped their tinnitus, is not so clear cut. And certainly, I think if you are struggling with your mood, it's well worth discussing. And again, for people with anxiety and depression and other affective disorders, which is the name for that group of conditions, pills are not always the answer, and talking therapy approaches are evidence-based in those groups as well, although they often have some of the same problems as tinnitus, where it can be difficult for people to access good quality talking therapies like CBT because of the way their local health service is configured or the costs associated with it.
Thank you. Okay. What do you think about acupuncture to treat tinnitus, not generally?
Yeah.
What are your thoughts about acupuncture and tinnitus?
Sure. So acupuncture, again, it's on Tinnitus UK, or British Tinnitus Association. It's two names for the same. It used to be called the British Tinnitus Association. It's now called Tinnitus UK. Their website's got a bit on acupuncture. Again, like the other things, if acupuncture makes people feel more relaxed, then there's no harm in it. Is there good evidence that acupuncture cures tinnitus? No, there isn't. Thank
you. And then I suppose there's a couple of questions here around tinnitus itself. So one is it normal to have tinnitus louder in one ear than the other? And the other is, what if your tinnitus doesn't seem to get worse related to your stress? Are there other reasons why you might notice your tinnitus more, even when you're rested and calm?
Okay, so I forgot I'm really sorry, I forgot what your first question was.
Yeah, I don't really know why I asked them together. But the first one was, is it normal to have one louder?
Louder
in one ear than the other?
Sure. So the perception of tinnitus, people can describe their tinnitus in loads of different ways. So sometimes they'll say, it feels like it moves between my left ear and my right ear. Sometimes they'll say it doesn't really sound like it's in my ear, it sounds like it's in my head, or it sounds like it's above my head or coming from behind me. And it's really not uncommon for them to say, I hear it worse in my right ear or worse in my left ear. And often when you look at the hearing test, their hearing's worse in the ear that they say that their tinnitus is worse. And that's possibly because that ear is getting less sound information from the world around you to help to drown out the tinnitus. And potentially then hearing aids are not a panacea for tinnitus, but they can be effective in some people. And that's a group where you might see some good benefit from that.
Interesting. Thanks.
And then I think
what
the second
about
question
if I hear my tinnitus more some days, even though I'm really calm and rested and eaten well? And
so tinnitus is not so directly linked to everyday activity that you can categorically say that I'm well rested, my tinnitus will be great, or I'm feeling good today, and I won't hear my tinnitus. That's it. Unfortunately, it's not such a simple direct relationship, and there is nothing wrong with you or strange about you if you find that the fluctuations don't seem to be obviously linked to what you ate, how you slept, whether you drank enough water, any of those things. That is a normal part of some people's experience.
What we tend to find working with people is that yes, it's frustrating not being able to draw a straight line. But the more that you embed healthy techniques for really learning to manage it and teaching your brain that the tinnitus isn't a threat, the more you do that, the less you notice it overall, even though you might have a calm day where you for some reason are hearing your tinnitus more loudly or intrusively. But generally speaking, you'll probably track a trend of progress as you learn how to basically manage it well and teach your brain that it isn't a danger to you.
Yeah, I mean, that's absolutely true. The other thing, of course, is if you if you're describing a calm day where you're at home and there's no background noise, people often report that their tinnitus is louder. It's why the most common thing people say when they come to the clinic about their tinnitus is, I notice it when I'm lying in bed at night. And it isn't that their tinnitus is louder when they're in bed at night. It's that in bed at night is a quiet time where there isn't noise from the world around you drowning out your tinnitus, which then makes people aware of it. And then they can often get into a vicious cycle where it starts interrupting their sleep, and then that makes them stressed, and then they're more aware of their tinnitus, and they start to feel it, you know, affects a bit more. So so in that sense, an entirely silent environment might be, you might notice your tinnitus more, even if you are calm and relaxed. So it's a bit like you know, if you listen to the ticking of a mechanical watch and you're in a quiet enough environment to hear it, or a clock, it sounds really loud. But actually the same clock in a room where maybe it's a bit of background music or there's people talking and you just don't hear it tick.
I was once in a bed, a guest bed that collapsed in the middle of the night, and I thought it was such an explosive sound because it was so quiet in the house. And then it happened again in the morning when everyone was up, and it was barely audible. Anyway, let's not get too sidetracked. Is there a relationship between tinnitus and vertigo?
So, that's an interesting question. So vertigo is the perception of movement, and the classical example of it is what's called rotational vertigo, which is the feeling that you are relatively still, but that the room is moving around you, or the world is moving around you. And that is often caused by dysfunction in the inner ear, although there are a number of other causes of vertigo, and a number of other types of vertigo that can relate to all of the components of your balance system. So your balance system is made up of input from your eyes, from your inner ear, from a sense called proprioception, which includes the feeling around your joints and touch. And all of these things help to tell your brain which way up your body is and where you are in relation to the space around you. And when you get a mismatch, for example, because part of that system is dysfunctional in some way, your brain struggles to put that input together properly, and that's when you get this hallucination of movement, perception of movement, which is, I guess, a long-winded way of saying that anything that damages that part of your inner ear that does balance, it's also possible that that would damage the parts of the inside of your ear that do hearing and are therefore related to tinnitus. And a classic example of that is strong antibiotics, aminoglycoside antibiotics like gentamicin or vancomycin, which are damaging both to the part of the inside of the ear that do balance and also the part that does hearing. So yes, there is a functional connection.
Thanks. There are a couple of questions that we won't have time to dig into too much around, you know, how to manage terrible days with tinnitus. And I just want to make it clear that you can manage those days, and CBT techniques are the key to managing those days. So if you haven't yet, we're trying to make help as accessible as we can. So do download the Otto app and have a listen to the course there. You will get better at managing those terrible days. And you just, it's a case of learning how to do it, but you can. And it links to a question that I saw towards the bottom, that can I get to a place where I don't notice it? You can't make it go away. That is correct. But actually, you wouldn't care that you can't make it go away when you get to the point that you don't care it's there at all. And you can get to a place where you don't care that it's there at all. And that means that you notice it less and less. So whilst you can't make it go away, you can get to a place where you don't care that it's there. And in response, your brain will notice it less. We don't have very much time at all left. So Jameel, do you have time for maybe 2 more questions?
Sure.
Okay, great. I love the question. Maybe Elon Musk will come up with a chip. Yeah, well, fingers crossed.
It's interesting you say that. So when people have a cochlear implant's a mechanical device that's electronic device that's implanted under your skin, and there's an electrode, so essentially a thin wire that coils down and is put into the cochlea, so into the inner ear. And interestingly, about 10% of people who have tinnitus before they have a cochlear implant, the tinnitus disappears. And we don't understand why that is, and we don't know how to predict which people that might happen to. But it is a fascinating thing to be aware of.
Yeah, really interesting.
Just thinking about implants that you've given.
Yeah, and research is ongoing. Like, I think we can have hope that we are improving in our knowledge. We will.
I wouldn't pin all my hopes on Elon, but
yeah, maybe not with Elon.
I think, you know.
We've had 2 questions around COVID, so I think it's fair to answer it. Is there a link between the COVID jab and tinnitus? And I saw one, let me look for it. I think it was a similar question. Is there an indication of an association with tinnitus and the COVID infection? So both the jab and the virus itself.
Sure. Okay. So slightly contentious issue because the data is not necessarily easily accessible about who caught tinnitus and when and got it, because tinnitus is really common, depending on which study you look at. Somewhere between maybe 8 and 15% of the adult population have got tinnitus, and it isn't always easy to see what this happened and then that happened, and therefore they're linked. COVID, the infection, is a procoagulant state, so it changes how easily your blood clots, and that means that the inner ear is fed by a very thin blood supply. And the thought is that if you are more likely to develop clots in your blood, that a tiny clot blocking off the blood supply to the inside of the ear might be a reason that people would get damage to their ear, get hearing loss, get tinnitus. That's one option. There have also been studies that have shown the COVID viral particle in the inner ear. So it may be that there's a direct effect from it. We know that vaccination, the initial phase of a response to a vaccine, can also be procoagulant. So it's possible that you may also get a bit of a risk for that. It's hard to know whether the risk of a vaccination is worse than the risk of catching COVID in terms of causing tinnitus, because we haven't got studies that compare those things. And also the picture has changed a lot with respect to COVID. There was a time not that long ago where I think most doctors would have unanimously recommended vaccination because the risk of getting seriously unwell or dying from COVID was very high. And now the strains of COVID that are circulating in the population are much less dangerous. Now in the UK, there's talk of another wave of vaccination programs fairly soon. And as a general principle, I'd encourage everybody to get vaccinated. I think there are few things, perhaps other than stopping smoking, that are better for your health than vaccination.
Thank you. Okay, we should probably round it off. Just a couple of notes. For those asking, look, I've tried a few things. What do I do next? As Jameel said earlier, the most evidence-backed way of managing tinnitus is CBT. This isn't to advertise Otto, but we are trying to get CBT out there. So if you download the app, you can begin that. You're looking for people who can help you manage it, as opposed to people who are telling you they can cure it. It can be really frustrating while you're waiting for a referral or something like that. That doesn't mean that you can't get started with trying to put some techniques in place that will help you to manage it. And I suppose just the last thing, someone asked if it was normal to feel like the tinnitus was more in the head than the ears. And as far as I remember you saying, Jameel, you were saying that is normal.
Yeah, I mean, that is one of the range of normal. That isn't, I would say, the most common, but it's certainly very common. People say that. You're not alone. And
so I think you can see the questions here, Jameel, can't you? Is there
I can, but I struggle to
Yeah,
to
do
keep up with
both.
questions and reading.
Okay, fair enough. Yes, that would maybe be triple multitasking. It would be good to have one to finish on. I suppose people will come across various therapies. So we've got something about notch therapy here. We've got a drug called Ambien, which is a popular sleep drug that might have a negative effect on tinnitus. That's actually a different question. I suppose maybe a good place to finish would be, in the wealth of information that is out there about how best to manage tinnitus, where would you want to guide people to? And when there are questions that we haven't answered, where would you want people to guide people? Where would you want to guide people to? So with the wealth of information that's out there, where would you suggest people look? And if there's a question that hasn't been answered here, where would you go to have it answered? Okay, so
that's a good question, because as you probably realize, there are a lot of people trying to sell you quack cures. A lot of the supplements, for example, that are offered have little or no evidence base to them, and it's people trying to make a quick buck off people that are struggling. So do be careful where you get your advice. I think seeing your own doctor or audiologist is often a good place to start. Online, reputable sources like Tinnitus UK or the American Tinnitus Association are good places to start. If you're interested in research studies, there is a portal called clinicaltrials.gov, which lists studies about all different kinds of condition. You type the name of the condition and it shows you studies that are about that. And that's a good place to look at that stuff. There is a website called PubMed, which is part of the American National Library of Medicine or National Library of Science, and that lists almost every published paper that comes out. So that can be a good way of finding information regarding if you wanted to know about a particular supplement, for example, and tinnitus, and it wasn't listed on the Tinnitus UK website, you could go and have a look at what the research studies are like themselves. We are generally happy to try to answer people's questions. I wouldn't pretend to have the answer to every question, but do our best to help you as best we can.
Brilliant, thank you. Excellent. I suppose it's just important to know that research is ongoing, and there is a future to tinnitus research. So yeah, do check out those sources that Jameel just mentioned. But also, as always, if you've got questions about this stuff, let us know. And we've got quite a few past webinars that cover some of this stuff as well. So if you do head into the app, go to events and have a look at the past webinars, you might find there's something there that you're interested in, and we'll try and keep you up to date with the latest research at events like this. So thank you so much, Jameel. You've done an absolutely superb job there at answering the questions, and I'm sure everyone really appreciates it. And thank you all for joining us. It's brilliant to speak to you, even though we can't see you, and wonderful to get your questions through. So thank you so much for contributing. Do come back. We will have more events and try and, get you scientific and trustworthy information as best we can. So yes, enjoy the rest of your evening or enjoy the rest of your day, depending on where you are in the world. And we will see you next time.